Medical innovations start with the ideas and visions of committed scientists. Successful innovations then evolve over time, not within weeks or mere months, but years, as they graduate through different stages of development that entail basic research and clinical research. The Kenya Medical Research Institute, Kemri, has in a similar manner grown step by step from its humble beginnings in 1979 to become a world-renowned medical research institution. In this respect, the development of its physical structures as well as manpower were carefully designed to respond to the most pressing medical issues of the time as it developed its capacity. As Kemri came of age after acquiring a critical mass of highly trained scientists, its research programs expanded to meet the challenges of the emerging and re-emerging health problems. So, the Institute reorganized its research programs into 6 thematic research areas as follows. 1. Biotechnology Program. Its objective is to promote, harness and apply biotechnology for the discovery and development of tools and strategies for use in medicine and healthcare that include vaccine development, diagnostics, genetic engineering, bioinformatics, among others. 2. Natural Products Research and Drug Development NAPREDA program is a Vision 2030 flagship project. Its role is to identify and develop effective traditional or alternative medicines and drugs for use against human diseases. 3. Infectious Parasitic Diseases Program. It conducts research aimed at developing tools and technologies for reduction of disease burden due to infectious and parasitic agents. They include bacterial, fungal and viral infections like HIV/AIDS, TB, Ebola, malaria, chikungunya, dengue fever and other neglected tropical diseases like Kala-Azar, bilharzia, among others. 4. Public Health and Health Systems Program. Its objective is to conduct multidisciplinary epidemiology, biostatistical, environmental, occupational, nutritional, social, dental population and health systems and policy research with special attention given to nutrition, oral health, healthcare financing, among others. 5. Non-Communicable Diseases Program. It involves conducting basic, clinical, operational, implementation and applied research in all matters related to non-communicable diseases that include lifestyle diseases like obesity, diabetes, hypertension, cardiovascular problems, drug and substance abuse, among others. 6. Sexual, Reproductive, Adolescent and Child Health Program. It basically conducts clinical, operational, implementation and applied research in all matters related to sexual, reproductive and child health that involves maternal health, child health, adolescent health, sexual dysfunction, sexually transmitted infections, gender-based violence, among others.
Kemri has established itself as a leading institute of research in the region and worldwide. To that effect, we actually have had to develop our human capacity, both in research and other supportive departments, as well as build on the laboratory capacity to be able to diagnose and offer the necessary services that research so much embeds itself in.
In Kemri, we have been able to cover all the spectrum of healthcare that we can be able to provide to Kenyans to be able to turn around their quality of life. And together we can be able to pull this through when we are able to identify what are the key issues and then use novel technologies, new technologies to address those issues.
Each research program is composed of a multidisciplinary group of experts drawn from local and international universities and research organizations, government agencies, institutional collaborators, and Kemri itself. Research conducted by Kemri has shown that out of 1.6 million people living with HIV virus in Kenya, 900,000 are on antiretrovirals. Although ARVs have reduced AIDS-related morbidity and mortality, they have resulted in HIV-1 drug resistance and emergence of new strains whose virulence is yet to be established. Unlike other viruses, the AIDS virus is highly evolving with a very high turnover rate of its genome. It is therefore critical to monitor the evolution of the HIV virus infecting the population to determine the prevalent genotypes and its impact, especially on existing diagnostic and screening systems and antiretrovirals. Through the research centers in Busia and Nairobi, Kemri have established the first ever HIV genotyping program in the country. Interestingly, the CVR laboratory has identified new and evolving HIV genotypes in Kenya, including the very rare subtype O, HIV-2, and a myriad of recombinants. Perhaps the greatest clinical impact of Kemri has been its contribution to HIV drug resistance testing in Kenya. Information from this study is expected to assist in the designing of vaccine as well as helping in making decisions on the change of treatment regimen, among others.
I was initiated ARVs 2005, and I've been on ARVs for the last 2005 to date, that's almost 12 years. And those 12 years has done it has actually been very helpful to me. I've actually seen my children gone to school, up to in the university. And then I'm seeing right now at the age of 52, and I got infected at the age of 28.
United Nations HIV program basically targets that by 2020, 90% of people who are HIV infected know their HIV status, 90% of those who know their status are started on medication, and 90% of those who are on medication are suppressing the disease.
We're interested in HIV, both in diagnostics and in epidemiology of HIV, and also in the molecular biology of HIV. Actually, that center, together with a few other labs in Kenya, conducts all the HIV diagnostics for the country in terms of infants and also in terms of viral loads. And in the future, we are going to be conducting HIV genotyping.
Similarly, in order to better understand how the body responds during the critical moments of early HIV infection, the Kericho site of Kemri is also participating in an innovative study focusing on the earlier stages of HIV infection to help understand what is needed to create an effective HIV vaccine.
In research, the scientists can be as brilliant as they want to be, but they will never get answers to our medical problems without the participation of the community.
Initially, we thought that they will not turn up for these studies, but they actually came and participated in these studies.
Kericho provided a very unique environment
to develop and do HIV vaccine studies.
The interventions used include very early broadly neutralizing antibodies, which are substances produced by the body to fight infections. Using the state-of-the-art laboratories certified by the esteemed College of American Pathologists, CAP, the study continues to monitor the progress of 2 babies and 6 adults who are apparently doing well.
The antiretrovirals we take, if you forget to take your medication, you develop resistance.
If, for one reason or the other, the individual who is on ARV medication is not showing the suppression, or is showing treatment failure, then that sample comes to our laboratory and we do drug resistance testing.
Kericho is a very cosmopolitan area. You have people from almost every single community in Kenya. And so it kind of becomes a melting pot. And also the virus you find here is kind of like a melting pot virus. It's actually a snapshot of the type of viruses that exist all over Africa. You will actually find it here. So we believe once we develop a vaccine that will work in Kericho, it will probably most likely be effective globally.
In another study, the Kericho team, in collaboration with the Boston University, have an applied research component which aims to produce documented evidence of the economic outcomes of treatment. Here, the Kericho tea plantations presented a unique opportunity since individual workers' productivity is measured in kilos, which equates to earnings. When a study was conducted there, it was observed that once a HIV-positive individual received treatment, though their productivity may have declined, there was a steady increase, and by 6 months, productivity was restored, which meant more earnings for them. Applied research therefore provides evidence for the core mission of public health, which is to improve the health of the populations for increased productivity.
So the story is told from the tea fields of Kericho, but I believe that the impacts will be heard even to the corporate level and even to individuals. As an individual, this is the message I tell you. Get tested, get treatment, and keep healthy, and that way you can maintain your productivity. You will maintain your family earnings and the livelihood of our communities.
Today, science is changing rapidly and becoming more complex. So no single researcher or single site can bring all the expertise together to develop and validate medical innovations or to ensure their efficacy. It is in this context that Kemri, in collaboration with the Center for Disease Control and Prevention, are conducting an antibody-mediated prevention study in Kisumu. This is a new technology that involves giving people antibodies passively to see if they will be protected against HIV infection. Preclinical and early clinical trials showed that this intervention was able to neutralize many strains of HIV by 90%. The AMP study therefore offers new hope and represents an important advantage in developing an effective HIV vaccine. This procedure differs from the traditional HIV vaccine studies where people get a vaccine and researchers wait to see if their bodies will respond and make antibodies against HIV.
HIV infection in infants progresses fast, so early diagnosis will inform timely clinical interventions. Typically, we are required to release results within 2 days of receiving the samples. The National HIV Control Program, NASCOP, oversee this program.
With the advent of HIV/AIDS and there being no effective cure, many claims of a treatment by traditional healers and proponents of alternative medicine emerged. Therefore, there came a need for the country to have a system to verify these claims through scientific inquiry, among others. Now, through the Center for Traditional Medicine and Drug Research, Kemri is able to verify and confirm such claims for what they are, true or false, by scientific means. Among other reasons, the P3 laboratory was established to conduct in vitro analysis and confirmation of possible candidate anti-HIV natural products.
Herbal medicine is very important and it works. The only thing we need to provide is scientific information to support the herbal medicine. If we provide that information, then we have all-round information to facilitate the integration of this herbal product in the mainstream healthcare system.
To this end, the Natural Products Research and Drug Development Research Program is one with the mandate to identify and develop effective traditional alternative medicines and drugs for use against diseases. For instance, through Kemri research, Zedupex, an anti-herpes herbal medicine for management of human herpes, has been developed and registered with the Pharmacy and Poisons Board, while 2 other plant extracts for tuberculosis treatment are under consideration for registration.
Our main mandate is to carry out research in traditional or herbal medicine to authenticate what our forefathers or the current traditional medical practitioners, as we know them, have been using over time.
The polio outbreak of 2013-2014 was the largest and most explosive to have been documented by the polio laboratory at Kemri. Arising from that outbreak, the laboratory supported the Kenya Ministry of Health to start poliovirus surveillance in sewage and wastewater sampling on a 2-weekly basis in Nairobi, Mombasa, Kisumu and Garissa. The laboratory is in a position to process AFP stool samples for poliovirus isolation. It is through that process that a wild type 1 poliovirus was confirmed in Eastleigh area in Nairobi County. The laboratory also undertakes routine diagnosis for measles and rubella. Out of its outstanding work, the Kemri Polio Laboratory is classified within the WHO Global Network of Polio Laboratories as a national and inter-country laboratory designated to serve Kenya, Somalia, Eritrea and Djibouti.
The Center for Virus Research has done all it could to be able to detect any wild polio case during that period. The last polio case was detected in 1984, and since then we've been on the forefront to make sure there are no other cases, except a few imported cases that have been detected during the surveillance.
One of the problems with diseases that cause fever is determining which one it is. Symptoms such as high temperature, headache, tiredness and muscle pain are common signs in many diseases. Given the change in WHO guidelines that recommended malaria testing prior to treatment, clinicians are now required to expand the scope of tests when malaria testing is negative. Therefore, there is need for efficient diagnostic equipment that can quickly determine the cause of high temperatures in patients so that appropriate treatment is administered without delay. It is out of this concern that a new diagnostic machine is being tested in Kisumu to help in determining the exact cause of a fever in a matter of minutes.
As you know, a lot of fevers are called malaria, but we've come to realize that a lot of fevers are actually not malaria. In addition to malaria, which is endemic in most places, there are other look-alike, and they will mimic as malaria.
And due to lack of national surveillance programs, the extent of infection with dengue virus among children is largely unknown in much of sub-Saharan Africa. Although reports of dengue virus infection in Kenya remain scanty, seroepidemiological studies done by the Institute have produced evidence of dengue virus in patients of all ages. In 2015, dengue virus infections were detected in adult patients with fever on the coast of Kenya. Therefore, improving efforts to detect dengue virus infections certainly raises awareness with healthcare providers to be constantly conscious of the likelihood of dengue virus infection in patients with high fever.
Results that we have so far, I would say on the vectors, we found, yes, Aedes aegypti is breeding in both these sites, specifically in the urban areas, and most of our collections were found outdoors. So this clearly indicates the risk of transmission is higher outdoors than indoors.
The relationship between Kemri and the Walter Reed Project has had a long-standing history of accomplishments in combating increasingly complex disease threats like Ebola, HIV, malaria, tuberculosis and multi-drug resistance organisms. In the process, this has led to developing increasingly complex tools like whole genome sequencing and rapid diagnostic tools.
Our partnership going into almost 50 years provides and the understanding that we have between Walter Reed and MRDK and Kemri and the Ministry of Health, it provides a perfect ground for that collaboration to grow.
Most recently, the collaboration has supported the President's Malaria Initiative rollout of National Malaria Quality Assurance Program, impacting 294 Kenyan health facilities with quality assurance training and efficiency testing for 121 officers. As a result, the manufacture and development of a new portable reader for malaria parasites and blood count for use in austere environments has been initiated.
We in Kemri, as we have grown, we have relied on partnerships as a model since 1979, and we have various partners, both local and international. And this is an area that we put a lot of emphasis in terms of building sustainable strategic partnership and relationships to support all the health requirements and to be part of the global knowledge network in terms of biomedical and human health research.
Clinical research studies are the reason medical care has improved in leaps and bounds in the past few decades. Without these carefully designed tests for new drugs or devices, treatment for diseases would not progress. The Scientific and Ethics Review Unit, SERU, is therefore central to research in Kemri. The unit's purpose is to facilitate research with human participants and to protect their rights and welfare. SERU reviews research submissions from Kemri and non-Kemri researchers interested in conducting research in Kenya.
Before we do the study, to make sure that it's ethical, that it's not going to hurt anybody, and that the people who are being done are being respected. For that, we call that particular unit the Scientific Ethics and Review Unit.
Likewise, Kemri ensures communities are engaged and involved throughout the process of conducting studies from the beginning to the end. It is so crucial that the communities get to know the outcomes of the studies they have participated in or supported in one way or another.
Over the years, we have also developed a deliberate mechanism to work in close partnership with local communities. We do this, we have a deliberate grouping or department that we have developed to actually do an active day-to-day engagement with local communities here, and also engaging more and more with local schools.
In December 2016, Kemri started community sensitization for PFSPZ vaccine. Interested parents with children within the required bracket age of 5 to 12 months were consulted for consent and recruitment was done. Prior to vaccination, the participants were screened and all information required obtained. Then there was daily follow-up at home for 5 days after vaccination as part of the continuing phases of the vaccination exercise. Instead of being administered intramuscularly, the vaccine must be given by direct venous inoculation to elicit a strong immune response.
The moment we have the consent from the parents, we organize for a specific day whereby we come to the school, arrange with the school administration. Then we come and do what we call a follow-up. That is a baseline follow-up whereby we start by looking on the immunology work.
The research that has had the greatest impact or has the potential to have the greatest impact in terms of public health, because malaria remains a major problem in our children and in the population in this part of the country.
From 2017 to 2018, an assessment was done by Kemri on integrating health services for pregnant women and children below 5 years of age within rural health facilities, including Beyond Zero mobile clinics. Dubbed Beyond Zero, the study was done in Kwale and Siaya counties, both within the high malaria epidemicity regions of coastal and western Kenya, respectively. In its findings, the study observed that most rural health facilities in Kenya, including Beyond Zero mobile clinics, are insufficiently equipped, have inadequate in-service staff, and are understaffed in their capacity to provide healthcare services under one roof. However, the study recommended the regular assessment of rural health facilities, including the Beyond Zero mobile clinics, may form the basis for informed stocking of drugs, equipment, staffing, and in-service training of health workers towards malaria pre-elimination.
The other way around is also working with the people within the Ministry of the Health in the county level, just to ensure the public health team, the community health extension workers, the CHAS effectively with the basics that they can empower the community units that they become more effective in vector control.
The Center for Infectious and Parasitic Diseases Control Research has for a long time been the main site for superficial fungal infection research in the context of human immunodeficiency virus, HIV, in Western Kenya. Here, a study by Kemri in the spectrum of superficial fungal infection is being undertaken at an outpatient clinic in Busia. The study has found that tinea is the most prevalent superficial and opportunistic infection in HIV patients in the area. It was therefore established that antifungal susceptibility testing plays an important role in managing and guiding treatment decisions.
We have other cases like other skin diseases like exploitive dermatitis, eczema, psoriasis, more so with the advent of HIV.
We're actually famous in Alupe for diagnostics around skin diseases, and in fact we developed some of the medications around skin diseases within our center, and patients come from as far as other countries, coast, southern parts of Kenya, just to access those medications.
Sesefly control remains a key component for integrated management of trypanosomiasis. However, lack of indigenous capacity and community involvement in vector control programs has impacted negatively on the efforts to reduce the Sesefly infection. It is believed empowering the county officers and local communities with skills to manage and implement the program, particularly in endemic areas, is vital in controlling Seseflies in Busia County.
In Busia County, we have cases of African animal trypanosomiasis as well as human African trypanosomiasis.
The Center for Virus Research, which is one of the oldest centers in the Kenya Medical Research Institute, has 7 laboratories and units located at the headquarters of Kemri, as well as its research campuses within Kenyatta National Hospital compound. The center also has several clinical research sites in Western Kenya, the Rift Valley and coastal regions of the country, with laboratories that handle overall research components, among them arbovirus and hemorrhagic fever unit, influenza and other respiratory viral disease unit, viral diarrhea unit, viral hepatitis unit, EPI disease, polio and measles eradication program, HIV and AIDS, and human papillomavirus. Since its inception 37 years ago, the center has made great strides and achievements in terms of developing laboratory and human resource capacity, which has placed it among the best in the world. The laboratory projects have been investigating on the following: specialization on molecular aspects of microbial infections and epidemiology. This unit is part of the Consortium for Pathogen Ecology and Epidemiology, COPEG, that was formed in 2017. Molecular epidemiology of urinary tract infectious pathogens, which generally form the most resistant populations of any infectious bacteria. COPEG unit is now a part of the initiative known as Holistic Approach Towards Unraveling Antibiotic Resistance in East Africa, HATUA. The unit was the core facility that supported diagnosis and molecular analysis of viral cholera strains implicated in multiple outbreaks in 2017 in Nairobi.
The role of Center for Virus Research is so important because for any outbreak of a viral disease, if it is not detected at the laboratory level, we may never know what is going on in the population. So this is the first stop for any situation, emergency that requires action, to provide laboratory capacity to detect the agents and to make sure we report accurate information, and so that action can be taken to bring down whatever outbreak is going on.
Following the outbreak of yellow fever in 1992, the Viral Hemorrhagic Fever and Arbovirus Laboratory at Kemri has now become the reference laboratory for WHO Regional Arbovirus Outbreak Response. It receives blood samples from local sources as well as from abroad, including countries like Somalia, Sudan, Eritrea, Tanzania, and Comoros, to test the arbovirus and viral hemorrhagic fever manifestations. The laboratory has also been involved in multiple surveillance and outbreaks of viruses, both locally and internationally. Recently, it has been used for the control of several outbreaks in northern parts of Kenya, including Mandera, among other counties. The history of the earliest influenza surveillance in Kenya was from sero-epidemiological studies, then called medical safaris, in the 1950s. Much later, the Japanese government, through JICA, sponsored acute respiratory infections ARI study in 1990 that covered surveillance in Nairobi and several regions in central Kenya. The JICA study was of importance as it introduced the use of molecular methods in viral ARI surveillance in Kenya. Lately, Kemri, in collaboration with the United States Army Medical Research Unit and Centers for Disease Control and Prevention, initiated sentinel-based influenza surveillance all over the country. Through this collaboration, the influenza laboratory at Kemri has been upgraded with state-of-the-art equipment to handle more complex aspects of this disease. This has all the more enhanced its status as a WHO-accredited National Influenza Center, as well as the reference laboratory for countries in East and Central Africa.
Young infants or children under 2 years of age suffer the greatest burden when it comes to respiratory illnesses, and specifically influenza.
Undernourishment is high among children under 5 years of age in Kwale County. In most instances, this occurs due to lack of knowledge on proper feeding habits. For instance, lack of breastfeeding, especially in developing countries, can lead to malnutrition in infants and children. According to the World Health Organization, malnutrition is the greatest single threat to global public health. It contributes to about 45% of deaths among children under the age of 5 years worldwide. In a study conducted by Kemri on the effect of nutritional counseling of primary caregivers and peer support on the nutritional status of children under 5 years of age, it transpired that by providing knowledge and influencing positive change in beliefs and behavior of caregivers plays a key factor in a nutritional intervention.
Kemri scientists in the field of perinatal, child, adolescent and maternal health are doing tremendous work, contributing immensely, not only in Kenya but on a global global platform to improving healthcare.
What began as a small collaborative program a while ago is today the largest program domiciled within the Center for Microbiology Research at Kemri. The Research Care and Training Program, RCTP, has the goal of conducting research, providing care and creating a supporting treatment with an emphasis on infectious diseases and with a bias towards sexually transmitted diseases, including HIV. The program is credited with a number of research trials, capacity building in research and care, and for the implementation of a HIV program commonly known as the Family AIDS Care and Education Services FACES project that has benefited millions of people with comprehensive HIV care and treatment. Some of the outstanding achievements of the program have been in the following areas: demonstrating that pelvic inflammatory disease, PID, in HIV-positive women can be treated as outpatients, influencing global policy on the pre-exposure prophylaxis among discordant couples, and placed Kemri on the global platform among the top 10 innovations of the year.
Pre-exposure prophylaxis was used 6 months after the infected person initiated ART, to prevent them from acquiring HIV. And this nearly eliminated HIV transmission.
Established Shamba Maisha as a study which is addressing the dilemma faced by those affected and infected with HIV/AIDS in Africa in terms of stigma and food security. Transformed lives and economic status through simple, small loans that has ensured food security and health of HIV-infected patients. Provided a platform for conducting clinical and implementation research.
Shamba Maisha is a study that looks at what are the economic options that are available for people who are HIV positive. When we provided treatment for individuals who are positive, there are some people who couldn't adhere to the treatment because they had no food to eat. So Shamba Maisha is an intervention that looks at if someone has access to land, and many people have access to land, they don't have to own it, but they may be able to farm it.
Neglected tropical diseases are the most debilitating ailments that pose socio-economic challenges to the affected families and communities at large. Since they are chronic in nature, they impoverish families and are not small in number anyway. They manifest themselves in the form of viruses, bacteria, as well as parasites, and they include infections such as leishmaniasis, leprosy, buruli, ulcers, dengue fever, tuberculosis, and many more. In this regard, Kemri's Infectious and Parasitic Diseases Research Program has been conducting research on the best strategies to deal with some of them. For instance, the Neglected Tropical Diseases Unit has brought together different researchers working on disease-specific issues. Their research work in Western Kenya has focused mainly on schistosomiasis and soil-transmitted helminths.
We are seeing a mixed bag of responses where we see some villages have appreciable decline in prevalence, as we would expect, following MDA, whereas in others we are seeing that the prevalence has declined but not appreciably as we would expect. And in others we are seeing things that have been fairly static even after the 5 years, which tells you that there might be some local conditions that might actually be influencing transmission.
We rely a lot on research to be able to get this evidence base that we are seeking. And of course, this is how now we actually work very closely as the Neglected Tropical Diseases Program. We have actually made a deliberate effort to work very closely with Kemri, which is the research arm of the ministry in the government, so that we can be able to leverage this institution to provide the evidence base that we need.
Commercial motorcycle and bicycle transportation system, commonly known as boda boda, has been reported to contribute significantly to the number of road traffic injuries both in urban and rural areas. In Busia County, road accident injuries due to motorcycles are a major but neglected emerging public health problem. This realization has prompted the Non-Communicable Diseases Research Program to initiate a cross-sectional survey on the pattern of injury and the risk factors associated with commercial motorcycle accidents. It is envisaged that data from this study will help in designing effective intervention measures aimed at reducing motorcycle accidents in the country.
Generally, nowadays people use boda bodas, motorcycles, and as people increase socioeconomically, then we are also doing very badly because people use vehicles instead of active transport to and away from their places of work.
The rise of non-communicable diseases in Kenya and throughout the world poses a threat to human health and a drain to the economy. NCDs such as cancers, diabetes and others account for 27% of the total deaths and over 50% of total hospital admissions in Kenya. This has warranted new approaches for prevention, diagnosis, treatment and cure of such afflictions.
Stem cell is the way to go, and the future is very bright. And once all this is harmonized and we will have stem cells that is very specific for all the diseases that we have, is that they will be well managed, and this will ease the disease burden and the suffering of the common person, especially our fellow Kenyans and also Africans and the world at large.
The field of stem cell research and regenerative medicine offers the opportunity to address the challenges the diseases pose. Stem cells are a class of undifferentiated cells that have the potential to develop into different cell types during early life and growth. They are an internal repair system which decides without limit to replenish other cells.
Here is where we want to develop cells that can come, very young cells can come from, say, the umbilical cord or the placenta, and that can be used and transferred to patients who are undergoing treatment for cancer. Because one of the major problems is that the treatment for cancer, not only does it destroy cancer cells, but it also destroys the human cells that are useful.
The Center for Clinical Research is the premier center at Kemri. It has a model hospital equipped completely for conducting clinical studies in Kenya. It is here that all other centers have emerged. The main function of the center is to lead in clinical trials in infectious, neglected and non-communicable diseases, as well as testing of diagnostic kits. The center also hosts the National Cancer Registry, collecting data on all forms of cancer incidences and trends in Kenya. At the moment, it is working on the establishment of cancer registers in 10 counties. It is in keeping with the spirit of devolving healthcare services to wananchi.
Looking forward and thinking forward for the institution and even for this center is to ensure that we become a regional hub for clinical trials, and such expertise is only found here in Kemri, where we have a dedicated platform for doing clinical research, and therefore we look forward to having the right capacity, the right infrastructure, and being able to establish the phase 1 clinical trials.
Indeed, Kemri has a comprehensive framework under which research activities and services are administered through 7 regional clusters that serve the 47 counties. The Institute is therefore working closely with the county governments to address county-specific research challenges and priorities in an effort to contribute to sustainable health solutions. This is in keeping with Kenya's Vision 2030 and the universal health coverage as one of the 4 key pillars of the government's development agenda. For instance, the Institute has signed Memorandum of Understandings with a number of counties on various research and infrastructural projects. In Kirinyaga, Mandera, Marsabit, Homa Bay, Taita Taveta, Bungoma and Isiolo counties, Kemri is jointly working with these counties to establish fully fledged research centers to meet specific mandates. Each of the proposed centers will have the following: a research center, training and referral hospital, a graduate school, administration block, conference facilities, a manufacturing facility, and a botanical garden. Kemri has already launched the construction of these centers in Kirinyaga and Mandera as a pilot project.
We are supporting this project. We are committed on behalf of the board. We are very committed simply because Mandera is a unique place where it is bordering Ethiopia, where it is bordering Somalia. You can control the movement of the people, but you cannot control the transmission of diseases.
Kemri is now collaborating closely with counties, and the desire of the Institute is to ensure that in terms of carrying out our mandate, we are collaborating closely with the counties. We are providing needed support to the counties. This is the only way that we can contribute in the achievement of universal health coverage.
Strong national health research systems are becoming important as they contribute to improvement of health as counties exchange health information on common internet platforms. It is for this reason that Kemri is developing a demographic and health information system to support research and control infectious diseases and health-related problems.
Health systems also is interested in disease surveillance and the epidemiology of diseases. This means where the diseases are occurring, are there any patterns as to the location, how frequently they are occurring, and the factors underlying such occurrences.
Commonly referred to as Health and Demographic Surveillance Systems, HDSS, the system has sites that are located in Africa, Asia and part of South America. Central to all, HDSS is a continuous demographic surveillance consisting of initial and repeat consensus of the chosen population, recording each resident and their associated information. The project is broadly aimed at solving problems in areas with similar prevailing problems.
We have a few scientists here who are very critical in guiding that process within government, and they participate with the other institutions at the Kenya National Bureau of Standards to at least give guidance on the critical methodologies that need to be used
undertaking the surveys.
We made some population-based research programs. That's named the Health and Demographics Surveillance System. That system registers all the people living in the area, and we conduct a population-based study.
With the emerging and re-emerging health issues, it has become important to look at health challenges holistically. The One Health approach is therefore looking at the interaction and linkages between human, animal and environmental health in order to address diseases, particularly the ones that are spread from animals to humans.
Kemri emphasizes on its research in the area of One Health approach. This, we have noted, is the interplay between human populations, animal population, as well as the environment. It is important for Kemri to continue to promote research in this area so that control of diseases will involve actually taking care of all of these sub-entities within development of diseases.
One of the major areas of focus is the antimicrobial resistance, commonly referred to as AMR. In this area, Kemri is working together with the government and the animal health sector to understand the impact of antimicrobial resistance in animals and its risk factors in humans. The goal of One Health approach is to ensure the country is responding to these concerns because they largely contribute to human and animal health.
The human health and the animal health respond separately.
The global antimicrobial resistance trends have reached a point
recognized by WHO to be a problem because most of the common drugs that are available for treating bacterial diseases are gradually getting lost because the bugs are becoming resistant to the microbes.
The Center for Microbiology Research has been the forefront.
Working very closely between the human and the animal health sector and the environmental sector to understand the impact of antimicrobial resistance in animals and the risk of that resistance being transmitted from animals to humans.
On the southern shores of Lake Victoria in western region of Kenya, Kemri is undertaking a preterm birth initiative, PTBI research, in collaboration with University of California, San Francisco and the Migori County government. Preterm births are a major factor in the neonatal mortality in Kenya, and that is why efforts are being made to reduce the burden of preterm births, improve survival and quality of life for babies that are born before their normal term. Through a novel approach known as kangaroo mother care, preterm and low birth weight babies are constantly nursed in a concerted effort by their mothers and fathers through skin-to-skin contact.
I gave birth while the baby was weighing 0.965, and I thought that the baby could not survive. And by the grace of God and with this program, the baby has managed to reach this far.
Preterm Birth Initiative is a great initiative that is focusing on a neglected group of people, because a preterm baby, when born in a home, sometimes is not even given a name. And when they die, nobody even reports that a baby has died, except for the mother who know the pain that they have gone through.
Deoxyribonucleic acid, though a tongue twister, is simply what we usually refer to as DNA. Its identification laboratory is up and running at Kemri, providing DNA testing in the area of family relationship testing and forensic DNA testing. However, being primarily part of a research institute, the laboratory is keen on maintaining its institutional mandate. It is therefore focused on initiating research programs in forensics as well as offering training modules to graduates. The laboratory has provided DNA identification services during major national disasters in the country. In addition, the facility has provided capacity building for several clients, among them the National Police Service, particularly the Directorate of Criminal Investigations, to ensure quality investigations.
Currently, we are training 30 officers from DCI, that is the Directorate of Criminal Investigation. They are currently putting up their labs, and it is expected that these officers will now go and start working in the newly constructed labs.
A lot of our clients are people who come in wanting to know the biological mother or biological father of children, especially in disputes where there is disputes in courts and so on. But we also offer these services where we have, unfortunately, calamities, where people are probably burnt beyond recognition, and there are several people, and you know these cases have gone on, and it becomes difficult to identify these remains. But we can do that by looking at their siblings, people who are born with them, or their parents, and will help us to identify these bodies. So we also offer that service.
Kemri has constantly aspired to remain among the best in medical research. That spirit drives the Institute to seek excellence in whatever they do. For instance, Kemri is also ISO certified and keeps upgrading to the latest certifications. Currently, the Institute is ISO 9001-2015 certified as a mark of quality standards in improving human health through research, capacity building, and provision of specialized services.
The office works with accreditation and certification agencies such as KEBS and SANAS so that we are able to advise management on the applicable standards in the Institute.
One of the departments that may be obscure, yet very important at Kemri, is the Grantsmanship Office. Its contribution to the overall effort of research at the Institute is crucial. The office contributes in pre-award stage, which is a grant compliance process that takes place before a grant is awarded.
Currently, we have about 200 applications going out to external donors every year. And it's my hope that in the next 5 years, the applications will rise to about 800 applications per year with a success rate of 20%.
It has been a while since the World Bank supported the establishment of the East Africa Public Health Laboratory Networking Project, which is regional in nature. It involves Burundi, Rwanda, Uganda, Kenya, and Tanzania. The main objective of the project is to support the establishment of a network of efficient, high-quality, accessible public health laboratories for diagnosis and surveillance of TB and other communicable diseases. Kemri's contribution to the network has been in the form of capacity building, mainly in antimicrobial resistance in the East African region. The EAPHL projects in Kenya are based at county referral hospitals in Wajir, Malindi, Lamu, Machakos, Nyahururu, Narok, Kericho, Busia, and Kitale.
We were looking at evaluating the new tools, new technologies, molecular tools, looking at how they perform. And we found that they perform equally in all countries, and they can also be adopted at any site, at any facility in a country, because they have high reproducibility.
Recently, we've been involved in trials that also target to reduce TB treatment to 4 months. So we are at the forefront of TB control and TB treatment.
In accordance with one of its core mandates, Kemri saw it fit to establish the Office of Resource Development and Knowledge Translation. It is responsible for developing standard structures for identifying, collating, packaging, and dissemination of research information to enhance consumption by relevant stakeholders. Now, with a critical mass of research data and evidence available and continues to be generated at the Institute through diverse efforts of researchers, it is only prudent for Kemri to continue using such avenues as the Kemri Annual Scientific and Health Conference to share its findings and experiences with fellow medical researchers and scientists who gather at the annual convention. The CASH conference is a forum for dissemination of research findings and networking, not just for the young scientists, but also for the more experienced ones.
Knowledge management is a spectrum from data collection, data synthesis, sharing this data, translating this data, and informing policy.
Eastern and Southern Africa Centre for International Parasitic Control, ESASIPAC, is yet another platform for exchanging information on prevention and control of parasitic diseases. Being a regional consultative gathering of scientists on how to combat parasitic diseases within their respective countries, a lot takes place in terms of information sharing at the periodic conferences of ESASIPAC.
It is through ESASIPAC and the work that we are conducting that we have trained
the 16,000 primary school teachers across the 27 counties in the country who are deworming the school-age children in the last 5 years, that is 2012 to 2017.
Parasitic infections continue to be of major public health concern, especially in developing countries. Efforts towards their elimination have not yielded the expected results due to reinfection after each treatment. So far, the only recommended strategy towards reduction of parasitic infections is through mass administration of drugs.
We are currently doing mass drug administration in the schools in Western, Nyanza, Rift Valley, and the coast. Total of about 20,000 school children are dewormed. And we are monitoring 200 schools. In each school, we are monitoring about 100 children.
True to its mission, which in part supports provision of training, Kemri is indeed committed to developing and nurturing young scientists in the field of health sciences. In collaboration with the Jomo Kenyatta University of Agriculture and Technology, the institute offers master's and doctoral training in health disciplines at its Graduate School of Health Sciences. All this is happening in the knowledge that the future of medical research at Kemri rests in their hands as they wait in the wings to excel.
We don't train undergraduates. We train graduate students only. And that is why we offer this service as a specialized service.
Through painstaking research, Kemri has over a period developed various diagnostic kits and other health products that include HepCell Rapid, a chromatographic immunoassay for direct qualitative detection of hepatitis B, ChemCom Rapid, a chromatographic immunoassay for direct qualitative detection of HIV-1 and 2, ChemTac, TAC polymerase kit, ChemPac Rapid, among others. TB-Side, a standardized disinfectant, ChemRub, a hand sanitizer, ChemPreg Rapid, a pregnancy test kit, and Kemri ready-to-use culture media.
Kemri scientists, they have stabilized these products, and currently we are manufacturing this product together or in partnership with local pharma companies.
And in the course of its research programs, Kemri has also developed linkages with premier international institutions such as the World Health Organization, WHO, Japan International Cooperation Agency, JICA, US Center for Disease Control and Prevention, CDC, the Walter Reed Army Institute of Medical Research, WIRE, Wellcome Trust UK, United States Agency for International Development, USAID, British Medical Research Council, Royal Tropical Institute Amsterdam, and the World Association of Industrial and Technological Research Organization, WITRO.
Kemri has developed a lot of partnerships and also collaboration with the key institutions the world over.
Collaboration was such a success that in 1973,
27 years collaboration with Kemri under the JICA project.
Kemri Wellcome is a collaboration between Kemri, Wellcome and Oxford.
I see the collaboration between Kemri and MRDK and RARE, our headquarters, expanding. Certainly the potential is there.
I think the future is very light, and I want to have more activities, and the Nagasaki Kemri partnership must be strengthened more, and we have more collaboration with Kemri.
So over the next 5 or 10 years, one of the things that I'm most excited about is the breadth and ability of young scientists coming up.
We are also accountable to ensure the finances we receive from them are well controlled, they are well accounted, there are no leakages, there is no fraud, everything is done according to the Public Finance Management Act.
Collaboration is paramount in any undertaking of the magnitude that Kemri has been engaging in with respect to sourcing for revenue or funds to support research, also training and many other things that go with research.
Kemri is a health research institution with a formidable research culture that is robust, responsive, and result-oriented. It is for this reason that it has developed a critical mass of scientists, technical and support staff that have been able to turn it into one of the best research institutions globally.
The innovations, the work that is going on within Kemri is appropriately documented and shared. When it is appropriately documented and shared, it will clearly contribute to the development of policies, to the development of strategies, and to the strengthening, to the improvement of the quality of service.
We expect to develop this institution to the next level. We expect this institution to be a center of excellence within Africa and globally. And how we want that to be done, we want to use technology as a way of developing this institution to the next level.
We in Kemri continue to engage the government to continue to support research in this institution to make it possible for us to provide them solutions that are so much needed in managing diseases amongst our own communities and the world at large.
And as the Institute continues to set its sights on the horizons of medical research, all it can do in the interim is to keep breaking new grounds in search of better health.